Thanks very much, Jane. Well, thank you so much for having me. I've just been delighted to be invited here today, and this morning's speakers were just so inspirational. It's a tough gig having the law slot immediately following that, but I'll do my best. So yes, as Jane said, I'm a solicitor, a partner in the child brain injury team in Bolt, Bird & Kemp. I specialise in representing children who have sustained a brain injury, and I also represent children and young people in relation to education rights. So that can be applying for an educational healthcare plan, ensuring that that plan is adequate, and if necessary, appealing the contents of that plan. What I would say is that I've done 2 webinars for success, which will provide more detail, really, that I'm able to go into in my slot today. So the first one was an introduction to EHCPs, and the second one was on school placements after an acquired brain injury. So that might be a useful resource for some people. I'm obviously also really happy to answer questions today. Don't be afraid just to come up and ask me questions afterwards, because I know that we're a little bit tight in time, so just approach me over lunch or whatever if you want to ask me any questions at all. I'll be happy to help if I can. So I'm going to have a really quick sprint through the benefits of getting an education healthcare plan for your child, how to request one, a few tips on the content, the process of mediation and appeals, and funding for legal support if you're going down that road. So what are the benefits of having an educational healthcare plan? Well, I was really struck this morning how much education came up already, and really how important the themes that were coming out were how important it is to have support in school to really kind of secure your child's ability to flourish and to reach their potential. And I would say that getting an educational healthcare plan is probably a really important part of that in a large number of cases. So one of the benefits of having an education healthcare plan is that it can provide support up until the age of 25, which is beyond the normal educational range we sometimes think about. It doesn't provide support in university settings, but does in and up to further education. It can be really helpful in respect of school placements. So regardless of the type of placement, there's a benefit of having a plan. Special schools or mainstream schools with specialist provision cannot be accessed unless your child has an educational healthcare plan. A further benefit is that whatever school is named in your child's plan has to accept your child regardless if their register is full. It doesn't matter. The local authority must fund the placement, and places in mainstream schools are usually allocated first to children with education healthcare plans. Further, through having a plan, your child could get access to some forms of education and equipment that they need that they may not otherwise be able to access, and that you may not be in a position to fund privately. So if it's to meet an educational need, your child can have access to things like occupational therapy, physiotherapy, speech and language therapy, in some cases pieces of equipment, rebound therapy, hydrotherapy, training for staff. All of this can be secured through an educational healthcare plan if it's to meet an educational need and to help your child access the curriculum. Further, if the document is well done, it can really help promote a holistic approach to your child's well-being and integrating their care and support in school as well as the care and support you provide at home. So it can be a really crucial document to summarising all of your child's needs, and it also includes social and health needs as well as educational needs. And finally, it is a legally binding document, so the provision that is set out in Section F of the Education Healthcare Plan, the local authority have an absolute duty to provide that provision. Now, that's quite a controversial statement, and some of you who have plans may already have encountered issues with that, and that's something I'm really happy to talk about on a case-by-case basis if anyone wants to, and how you can challenge the local authority if your child isn't getting the provision that is set out in their plan, because it is a well-acknowledged big problem. So how do you go about getting a plan? So to get an EHCP, you need to request an EHC needs assessment, and the test to do that, you have to ask yourself, might my child have special educational needs, and might they need special educational provision to meet those needs? And if the answer to that question is yes, then you should apply for an EHC needs assessment. One of the things you should ask yourself is, do the schools support it? Because really, ideally, you want to have the school on board with you. Now, it's not to say that you can't apply if the school aren't on board. It's more helpful if they are. And what do you do then? So you or the school need to write to the local authority, the SEND team or the director, What do you set out in that letter? I would say put in as much information as possible. Detail why you think an educational healthcare plan is needed. What do you think your child's special educational needs are? What do you think they need to be able to access the curriculum? Do you think they need specialist teaching? Do you think the staff need training on some aspects of your child's presentation? Do you think they need one-to-one support, small group work? Do you think they need specialist equipment? Set it all out. List any difficulties that they have. Include any relevant information that you hold, so any medical reports, any therapy reports from the NHS. Sometimes it's appropriate to include things like video footage or diaries, details of developmental milestones. It's usually appropriate to give some details about what the history is, what's led to you believing that your child may need an education healthcare plan, and maybe details of challenges they're currently facing in school, how they were before their injury, how they are doing now, what you see as the main issues, and I suppose really crucially, what you fear they will miss out on if they don't get the support that you think that they need. I've put up there private reports. I mean, to help evidence these needs, if you're in a position to get a private report from maybe a main area of need that your child has, be that OT or physio, speech and language, it'll obviously vary from case to case. It can be hugely beneficial to have a private report. That's not an option for a lot of people. I completely appreciate that, and it's not essential, but if it's something you can do, then great. If not, it might be worth having a conversation with your NHS therapist to see if they can write a letter in support. Because the reason I say that is that if and when we get to the point of me explaining if you need to appeal the contents of your plan, the tribunal is an evidence-based tribunal, so they'll want to see professionals saying that your child needs X. If you want your child to have certain occupational therapy input, really you need an occupational therapist to be saying they need it to access the curriculum. Finally, what I've put up there is don't be put off by misinformation, because there's a lot of it out there. Some examples are that you need to have an educational psychology report. You don't. Another example is, you need to show your child is 1 year behind, 2 years behind, 3 years behind. You don't. You also don't need to show that the school has used their notional £6,000 budget for special educational needs. So I would just be cautious about any misinformation that is out there and that's putting you off. So if you have the EHC needs assessment, then the local authority will arrange lots of assessments for your child, and they should produce a draft report which they will send to you. You'll have 15 days to provide comments, which is a really short period of time in my view for parents and families who are already really busy and dealing with a lot, but so be it, that is what it is. Some things to look out for. So education versus health provision. I often see in draft education and healthcare plans provision being put into section G as a health provision, and the reason it's often appearing in there is that if it's in section G, the local authority don't pay for it, the NHS pay for it. So some things end up getting shunted into G that are actually an educational need, not strictly a health need. So just keep an eye out for that. Look at what's in section G and ask yourself, does my child need that to actually access education? And if they do, then it should be an F. Lack of specificity is a big one, and local authorities shouldn't be drafting education healthcare plans that aren't specific, but I see them all the time. So things like access to hydrotherapy doesn't mean anything really. What you want is your child's name should have will have two sessions of hydrotherapy a week, each lasting 30 minutes, something really specific, because it is a legally binding document. You want to be able to waive it and say, my child's not getting this. And access to hydrotherapy, that wording doesn't really help you. Another thing I've put up there is training as education. Many children with acquired brain injuries and complex needs will require some training, perhaps in independent living skills, maybe some training using communication devices, some training perhaps using a powered wheelchair for some children. You might not necessarily think of training as education provision for your child, but it is and should appear in section F as well. And included there is staff training. And we talked earlier about how, there are a lot of teaching assistants and teachers who just want to know more and don't feel like they can offer this support because they don't have the information, they don't necessarily know what they don't know. So training is a really important part of what should appear in section F. There's also huge benefits to being able to work with an educational consultant if you're in a position to do so. They're extremely well versed in making sure that education and healthcare plans are in the best shape possible. Again, not an option for everybody, but it's just something I put out there as really valuable if you're in a position to access it. So what can you appeal to the tribunal if you find yourself in this position? So I've put up there all the things that you can appeal. So that can be a refusal to carry out a needs assessment, to issue a plan, to reassess, to amend a plan, to maintain a plan, and the actual final version of the plan. You have to consider mediation within the law as it currently stands. That may be changing, but at the moment you have to consider it. You don't necessarily have to engage in mediation, but you have to consider it. And what I would say is, ask yourself, is there room for compromise between what I say my child needs and what the local authority is saying that my child needs in the plan? And if there isn't room for compromise, really, from your point of view, in many cases, the mediation is just going to drag things out, and you might just be better getting on and appealing the plan. In other circumstances, a mediation might be appropriate. It's really difficult to say. Like I say, a case-by-case basis. Deadlines which strike fear into the heart of every lawyer. You've got 2 months from the date of the letter advising you on the right to appeal, or 1 month from the date of the mediation certificate if that's later. You can sometimes get an extension of time, but I would say just you don't want to be in that position where you're having to ask. So always note the deadlines really carefully. Funding for legal support is a question that lots of people have, understandably. So a lot of firms can help through legal aid. They can provide some limited support for appeals to the SENDIST. Private funding is another option. You don't tend to see no-win, no-fee agreements in this area of practice, but what firms like both Bird and Kemp will do is that we ensure that junior solicitors are carrying out the bulk of the work so that the costs are kept to a minimum, with more senior solicitors like myself overseeing and supervising. Compensation claims are another form of funding, really. So if your child has got an ongoing claim or a concluded claim, the funds can be used to pay for an education solicitor to help you, because ultimately you will be protecting the pot of damages if you can secure provision through the local authority that you would otherwise be paying for privately. So it's often seen as a good use of money to protect the pot in the future. And then some firms also have social justice funds that you can apply to for help as well. I mean, what I would say is, as a final remark, is don't be afraid to push local authorities yourself. Even if you can't access legal support through these means, there are charities that can help. IPSI is a great one. Contact also offers lots of great support for educational needs. There are lots of model letters on both those websites that you can use and adapt to your child. I mean, it's great to have legal support if you are appealing, but it's not crucial. The tribunal can be really understanding of litigants in person, and the statistics are hugely encouraging, in the high 90s of families succeeding when they go to tribunal. And I think an example of that was Callum's mother earlier, who was speaking about her experience with the tribunal. So you shouldn't have to in many of these situations, but try not to be afraid to push it if you do need to. So we very quickly sprinted through the benefits of having a plan, how to request one, tips on the content, mediation appeals, and funding. I'd be really happy to answer any questions now, or I can chat to anyone who wants to speak to me later. Thank you very much.